Welcome back to the Doctor is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for joining us today. Today, I feel, is a very special television program. I'm delighted to talk to you about one of my favorite procedures in plastic surgery, something that I enjoy doing very much, and we're lucky to be busy doing it. That's the natural neck lift. During the next segment, we're lucky to have one of my patients, who's an esthetician, join us here in the studio. She had a natural neck lift, and she's going to tell us all about her experience and what it was like. So I'd like to do this first segment on teaching you and conveying to you the truth as I see it about the natural neck lift. First of all, you've heard me say in the past, the natural neck lift is a system of analysis where we look at your anatomy, your goals, your desires, so we can together custom design approach resulting in a natural appearance of your neck, chin, jawline, etc. You've heard me say as well in the past that many people are reticent to have a facelift, and they wonder if they have a facelift, or wonder if they should have a facelift, when in reality what they really need is a neck lift. For both men and women, it's my opinion that a crisp, clean, well-defined, strong, smooth chin, jaw, and neckline is really a great foundation for a beautiful face, a handsome face. So let's go back to our common principle, the triangle of beauty. You've heard me talk about the triangle of beauty. There are three parts to the triangle. Number one is the skin, and that's the texture, that's the surface, that's what we see in really the epidermis. The dermis can influence that, but really what we see, the very superficial part of the skin, is the epidermis. Now, the very top portion of the epidermis is the keratin layer. It's like skin and nails. It's not really living. When that layer gets too thick, the skin can lose some sheen, and of course the skin is affected by issues such as fine lines and dyspigmentation and etching, etc. However, return to our triangle of beauty. The first part that we consider is the skin. The second part is volume. As you know, as we mature, we tend to lose fat in our hands and in our face, and we put that fat on, we put the weight on in our trunk. It's really an unfunny practical joke. What's the third segment of that triangle, the third corner of the triangle? That's the soft tissue position and amount. As we lose the fat with time in our face and gravity tends to pull down and affect us, we get mid-face descent. Oftentimes the neck will actually gain volume as we have a shift from the face down into the neck. So what most people consider plastic surgery, that's what we're talking about for the third corner of the triangle. So once again, it's the skin texture. That's what we see, the very top layer. Number two is volume. As we mature, we tend to lose fat in the face and in the hands and put the fat on in the trunk. And then there's soft tissue position and amount. That's traditionally what people consider surgery or plastic surgery. Now, the triangle, when we talk about the triangle of beauty for the face, it rests upon a foundation. Now, when we talk about neck and jowl lifts and the natural neck lift, we need to actually consider the foundation. What about the chin? Is the chin retrusive? Does it come out too far? Is the jaw well defined? What about the trachea? What about the deep fat and the submaxillary glands? And of course for the face, the foundation, the cheekbones, the temple areas, and of course we can also consider the nose and the ears. But again, the triangle of beauty is something that I think is very important in facial and neck analysis. The skin is one part of the triangle, one corner of the triangle. The volume is another part of the triangle, and the soft tissue position and amount is the third triangle or third corner, third portion of the triangle that we can affect. And then of course that sits on the foundation, the chin, the jaw, the cheekbones, the nose, etc., the craniofacial skeleton. And of course there can be changes of the craniofacial skeleton with time. So once again, the natural neck lift is a system of analysis. And just like we're analyzing the face, just like we're doing beauty analysis, we need to go layer by layer, because high quality, safe, effective plastic surgery starts with an accurate knowledge of the anatomy. So we need to look at individuals as they are. Everyone ages differently. Some people are exposed to a lot of sun. They love to bake in the sun in Southern California. Other people get very little sun if they live in Northern Canada or in London, etc. It's based on your genetics and your diet and your exercise habits, etc. So everyone ages differently according to their genetics and their hormonal level, etc. So we need to treat you as an individual to custom design and approach. So as we go through our beauty analysis, just like in the face, if we look at the neck and jowl area, the jaw, the chin, etc., we need to look at the skin. Now, I'm a big believer in skin care. As I said, the very top layer of the skin on top of the epidermis, that's the keratin layer. It's like skin and nails. It's not living. When that keratin layer gets too thick, if the skin gets dried out, if you're exposed to lots of wind and sun, that keratin layer can get thick and the skin can lose its sheen. The dermis can get thin. The collagen layer within the dermis, let me back up for a moment. Collagen is the basic building protein block throughout the body. It's the collagen within the dermis that gives the strength. The blood supply is in the dermis. That's really the business end of the skin. That's where new cells are made within the germinal matrix. And the truth be known, there's the papillary dermis, there's the reticular dermis, etc. So the skin is a very complex structure. And keep in mind, the skin is the largest organ in the body. So again, in terms of discussion, it's the epidermis on top of the dermis. We need to pay attention to properly moisturizing the skin of the neck and face, avoiding the sun, avoiding smoking. We want to teach you how to care for your skin with exfoliation, encouraging regeneration, proper moisturizing and proper cleansing. I think what we will do is interview Gio, our esthetician, who's been kind enough to come on the program during the next segment, and we're going to learn a lot more about skincare. Now, before I go on to the next step of analysis for the natural neck lift, keep in mind that we need to be very careful, very judicious when we're talking about resurfacing the skin of the neck as compared to the skin of the face. Now, we tend to be a little more aggressive with rejuvenation of the skin of the face. That's because the skin of the face has lots of what we call appendages, pilosebaceous glands, hair follicles, sweat glands, sebaceous glands, whereby there's a relative shortage of those appendages within the skin of the neck. So we need to be very careful if we ever consider laser of the neck, if we ever consider a TCA peel of the neck. We need to be very careful, very judicious. And that leads me to an important lesson. What I like to convey to my patients, that I think the best results from skin care, especially of the neck and the face, is not by just coming in off the street and having a laser treatment or a TCA peel. It's by priming and preparing the skin, long-term skin care. Then you can have the resurfacing procedure or stimulating procedure, such as a halo or TCA peel or resurfacing laser, CO2 laser, etc., especially for the face. And then you want to have post-op care over a long term to maintain your result and actually improve your result. So once again, very judicious resurfacing, very judicious treatment, careful, gentle of the very delicate skin of the neck. That's the surface of the skin. Now, the next layer that we want to look at is the skin itself, the epidermis and the dermis. Now, oftentimes the skin of the neck will lose its resiliency, there'll be too much of it, it'll be lax. Now, when there's too much skin, we need to tighten it, we can remove some, etc. Now, oftentimes I'll do that by making a short incision in the submental crease. Most Americans have a little scar in the submental crease anyway, because their little brother pushed them down the stairs, or they tripped on the curb, or fell on their bike, etc. So most people have a little scar under the chin anyway. Oftentimes I'll make incisions behind the ears, in the hairline, in the what's called the retroauricular crease behind the earlobes, and I sometimes come to the front of the ears, right within that crease. It can be modified along the tragus. I can go in just barely inside the external canal a little bit. That scar tends to do very well. And I can combine that with a cheek lift, incision, cheek elevation by going up towards the temporal tuft or the sideburn. Now, the other layer we need to analyze when we're preparing or analyzing someone for the natural neck lift is underneath the skin. That's the subcutaneous fat. Now, when someone does not have extra skin, or they have resilient skin, and they do have redundant subcutaneous fat or adipose tissue, there are a number of options. First of all, I like microliposculpture. Microliposculpture is a type of lipoplasty or liposuction where I insert a very small cannula. It's almost like a big needle. And I can attach that to suction, and I can suction and mold and shape and tailor. It's something that I do myself. It's handmade, it's manual. It's not the type of laser that you might hear of where you connect a laser, plug it into the wall, it's inserted underneath the skin and the fat kind of sizzles. The tech or someone might come back in 20 minutes. No, this is me molding, shaping, tailoring, getting at that really important subcutaneous fatty layer. Another way that we can affect that layer is by a direct lipectomy. Sometimes, again, I can make that little incision in the submental crease. I try to keep it small. I use loop magnification and fiber optic lighting so I can directly take a scissors or electrocautery, sometimes a scalpel, and I can mold and shape and tailor and move the fat around, take some away, etc., shift it around. That's very important. Now, what's the next layer we need to look at for the natural neck lift? We need to look at the platysma muscle. The platysma muscle is very important. Some of you are familiar with the platysma muscle, especially if you're a horse rider. Think of the horse that has a huge mandible, a very long mandible. That's the jaw. The platysma muscle runs about 2/3 of the way down the body of the horse, and that's the shivering muscle. That's part of the way the horse keeps off flies. In our species, it again starts at the mandible, but it stops at the clavicles, and it really has no other function other than to give plastic surgeons work, and that's the platysma muscle. When it gets lax, or technically when the superficial cervical fascia gets loose. Fascia is a layer of collagen. It runs throughout the body in different places, different levels. It can be very thick and tough and heavy like a leather belt holding in the abdominal musculature, etc., and that can get stretched out with pregnancy. It can be relatively thin and wispy. But the fascia is collagen that holds tissues in place, for example, muscle. So when the superficial cervical fascia gets lax and loose, it allows the platysma muscle to descend and get bands, oftentimes in the middle, sometimes in the side. Sometimes people will come into the office and they say, Dr. Morwood, I want you to do a wattlectomy, or my grandkids make fun of my turkey neck. Can you remove this extra skin? Actually, it can be a component of lax or loose skin, but more often we need to look at the platysma muscle. Now, if you have a lax platysma muscle, custom designed approach, you're not going to get the same recommendation that someone with tight skin and tight muscle with a little bit of extra fat gets. You're going to probably get a recommendation of a platysmoplasty. Platysmoplasty, again, can be done through the submental incision, through the crease, and I oftentimes will come in the side and do a lateral platysmoplasty to tighten up, redrape the muscle, etc. Sometimes I'll cut a little part of it to move it around. Sometimes I do a Z-plasty, but in any case, it can be suspended and redraped and tightened, much like a hammock. If we tighten it up in the middle and redrape it and tighten and firm it up from the sides, you can restore that kind of hammock to give a clean, crisp neckline. And this is a live television program. I need to back up for one moment. I talked about the fatty layer above the platysma muscle, so in between the skin and the platysma muscle. There's another sort of fat melting, fat busting procedure that med spas, a nurse injector, or the doctor can administer, and that's Kybella. Kybella essentially is deoxycholic acid. It's the same, similar to the same chemical that the gallbladder makes, bile. Well, actually, the liver makes it and stores it in bile. So that helps break down fat. There's pros and cons of that. It's minimally invasive. It's injected with a needle. You have to be able to tolerate a few treatments. You get markedly swollen, and then that chemical, the deoxycholic acid, can help melt the fat. And, you know, the truth be known, there's pros and cons to microliposculpture, pros and cons to Kybella. I really can't endorse Kybella without evaluating someone, so you really need to be evaluated by someone experienced in this area, a plastic surgeon, perhaps a dermatologist. We will oftentimes have a trained nurse injector to do this. But again, what we need to do, what I think is the important principle, is that we go layer by layer. We look at the superficial skin, the appearance of it. We look at the amount and resilience of the skin. We look at the fatty layer and evaluate if something needs to be done there. We look at the fascia, and we look at the platysma. Now, going one step further, there are important structures underneath the platysma muscle. There are the submaxillary glands. Some people have quite large or quite prominent submaxillary glands. They can be called the submandibular glands. Those are responsible for making the saliva or spit underneath the tongue. I'm very judicious, very conservative with recommending removing part of that or shaping them, tailoring them. Sometimes we can remove a little bit of the superficial lobe. I'm not a big fan of removing the entire submaxillary gland on both sides. I think the danger is dry mouth. So I think there's a trade-off when we talk about submaxillary gland surgery. Now, there is an important fatty layer deep through the platysma muscle. Now, that layer can be molded and shaped and tailored, most often under direct vision. I don't like to do that so often blindly, but I can mold and shape and tailor that subcutaneous fatty layer under the platysma muscle. Now, recall that I said with time we tend to lose fat in the face and in the hands and put weight on in the trunk, put that fat on in the trunk as we mature. There's some evidence that perhaps that deep fatty layer and perhaps the superficial fatty layer actually increases with time. It may be due to fat descent, soft tissue descent, or it could be related to hormonal changes. In any case, it's certainly possible, and oftentimes people need to have that fatty layer underneath the platysma muscle addressed, and we can mold and shape and tailor it. Then, of course, sometimes if someone has too prominent a trachea, we can do a tracheal shave. Then we get into analyzing and making recommendations in some people for the foundation. As I said, we talked about chin. The chin, does the chin need to come forward? What about the jaw, etc.? What about the trachea? There are all kinds of ways that we can affect the jawline itself and the chin line. We can do fillers. We can do fat grafting, fat reinjection. And of course, we could do a chin implant. We can do a bony advancement osteotomy. That's where we bring the chin forward. We can modify the jaw itself. We can do filler. Oftentimes, someone will want more of an Angelina Jolie look. She has quite prominent mandibular angles, and also Brad Pitt. Prominent mandibular angles that can give someone a micro lift if we do fat grafting, fillers, etc. So these are all parts of the very careful individual analysis we do before embarking on a natural neck lift or a neck and jowl lift or a lower cheek and jowl and neck lift, etc. Now, before I sign off during this segment, I want to mention that we have a very valuable, very powerful piece of equipment in my office. It's called a Vectra computer imager. It's a 6-camera setup, and those images are fed directly into a computer. So it's like you're having your picture taken. It just takes a second to have your image processed with 6 cameras, and that's fed into a computer, and then you can view yourself in 3 dimensions. You can rotate yourself, look at yourself from the side, different angles, from the so-called crow's view, from the so-called worm's eye view, and we can do some sculpting and give you some idea of what you like, some idea of what your surgical result might be similar to. It's not a guarantee, but I find that my patients find it a very valuable, powerful tool of communication to convey what they like, what they want changed, etc. So that's the Vectra computer analysis right here in my office. So if you'd like any more information about the natural neck lift, neck and jowl lifts, face lifts, anything to do to improve your appearance, I hope you'll call my office, 831-646-8661, or go to my website, drmorwood.com, drmorwood. I'm delighted you could be here. Once again, I'm Dr. David Morwood. This is the Doctor is in Television program, filmed live here in beautiful Monterey, California. We're going to take a very brief pause for a very good cause. I hope you stay with us. We've got a very special guest.
It's scary making the decision to have reconstructive surgery, but it's so worth what you get out of it.
I'm stress-free. I know I'm not going to get breast cancer.
Everything is back to normal, and it really did not take long to bounce back.
I have a sense of hope for other women. that this surgery can help them to live normal lives.
This year, more than 200,000 women in this country will be diagnosed with breast cancer. For many of them, a mastectomy or removal of the affected breast will be recommended as part of the cancer treatment.
The idea of losing a breast for some women can be almost as difficult as being diagnosed with breast cancer. Modern breast reconstruction can help. The purpose of this presentation is to provide women with valuable information about the major issues in breast reconstruction.
We'll have an opportunity to speak with women who chose different methods of reconstruction. We'll talk to experts in the field of breast cancer, and we'll let you know your options for breast reconstruction.
I embraced the mastectomy and reconstruction procedure, and because of that, I had a terrific outcome, and it's changed my life in a positive way.
For the thousands of women who will be diagnosed with breast cancer this year, we understand this is most likely a troubling and frustrating time. We hope this presentation's been valuable to you and will help you make some very difficult decisions that you're facing.
Welcome back to the Doctor is in Television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. I'm so glad you could be here with us. I have a very special guest today. Gio Stefagio, you are a licensed esthetician.
Yes.
And I'm proud to say, I'm happy to say, you had a natural neck lift.
I did.
And not only that, I was your surgeon.
You were.
So, Gio, I think this is so great you're on my program, and thank you for your willingness to teach and tell people about the natural neck lift and your experience. And so we're going to talk for about 19 minutes. This is the segment about your experience with the natural neck lift, and then we're going to take a break, and then we're going to have you back, and we're going to talk about your work as an esthetician.
Perfect.
So what I think is great, Gio, your willingness to come on the program. You're a medical professional, and not only that, you're an expert in aesthetics, you're an expert in skincare, and you had a natural neck lift. And so I think you're in a great position to really teach. And I've told you that I want you to be totally honest. Don't sugarcoat anything. Don't minimize. Don't exaggerate. We're not here to sell. We're here to teach, right?
Excellent.
Okay, so let's kind of start at the beginning. You're a licensed esthetician.
In the state of California, I'm also multi-state licensed.
Okay, so you have licenses in many states.
Yes.
And I think that's important. We're going to talk more about that in the next segment. But what that really means, state by state have different requirements, and licensed estheticians in some states can do laser, for example.
Yes.
In other states they can't. For example, in California, estheticians don't do resurfacing laser.
No, they cannot. Or microneedling or dermaplaning.
Okay, so anything that's invasive, really, or below, I guess below the epidermis or below the dermis, estheticians don't do.
Correct.
So we're gonna dive into that in more depth in the next segment. So let's start at the beginning. What was it that attracted you to come in and talk about neck and jowl and chin rejuvenation as opposed to coming in and saying, oh, I want a facelift?
Well, I was very fortunate to attend several of your little seminars that you host about once a month on different topics. So I knew that I was going to have this procedure. I knew like for a couple of years. So I was in the process of interviewing, if you will, different doctors and surgeons in this area. So I had, I don't know whether you remember or not, but I used to sit front and center at your little seminars, and I went for several times, and I'm very, very comfortable with you, and that's why I chose you as my surgeon.
Well, Gio, thank you. So okay, here's a shameless plug.
Okay.
So I have a series, and it's an educational series. It's called
Yes.
The Truth About Plastic Surgery. And what we do is sit with people. Sometimes it's a huge crowd, over 50. Sometimes it's just a dozen. And I show before and after pictures and diagrams. We have a seminar on the eyelids, and we do one on breast, and we do one on the natural neck lift, and facial rejuvenation, and one for men, and body contouring, and on and on. And it's a way that I can have an opportunity to convey to people the truth as I see it about plastic surgery, because there's so many myths and misconceptions, and I show actual before and after pictures of patients who have given permission. I show diagrams, I talk about my approach, I talk about high quality plastic surgery and your options for anesthesia, etc. So thank you for attending. So what was it about a natural neck lift that attracted you or sounded attractive to you, as opposed to, you know, nobody knows what a facelift is. I can tell you that. Some people say a facelift, oh, you have a huge incision in the scalp and you have a forehead lift and you have your eyes done and your cheeks, and yes or no, maybe the nose and lips and neck and jowls, and that might be a so-called total facelift. You didn't need that at all. But I agreed with you when you came in and you said you wanted a neck and jowl lift.
Mm-hmm.
So
yes.
what you're a beauty expert and consultant, but what was it about that it was attractive to you as opposed to a full facelift, so for example?
Well, when I would look at myself in the mirror, I'm going to be 60 on October 7th, and when I would look at myself in the mirror, I would see just this. And I would see where my jowls were getting much more pronounced. And I would look at my profile in the mirror, and I would see, you know, those muscles and skin hanging down. And for a woman, that is a telltale sign of age. You know, it just makes you look older. You can, you know, do your eyes, you can have the Botox, you can get this looking really nice without lines, but this really did need attention, and this was not going to go away with any type of a peptide cream or, you know, any type of a procedure other than surgery. So I was very glad to be able to have that, and the results are just perfect. I just am so pleased with the results.
Well, Gio, I feel very grateful that you're so gracious and you're willing to show your appreciation and tell people about your appreciation. I appreciate that. And let's dive into that in a little more detail. So you are an esthetician, you're licensed, you've taken great care of your skin. I'm not just giving you needless compliments. You have great skin.
Thank you.
And do you mind, again, how old are you? How young are you?
I'll be 60 in about 2 weeks.
See, you look great. And
Thanks.
To your tribute, you have a great facial skeleton. You have strong cheekbones, you have a nice chin, you have a jawline, you have a nice shape to your face. You have big eyes that are attractive. So when you came into my office, I didn't recommend a lot of other procedures to you. I agreed, as far as I remember. I thought, bingo, you're right on. You need a neck and jowl lift, right?
Yes.
So let's talk a little bit about the mechanics of it. So I want to talk about your anesthetic choice, where we did it. I do some of these in the office. Some people have an anesthetic at the surgery center or at the outpatient part of the hospital. And I want to know if you stayed overnight, what about the activity level, etc. So tell us about the experience.
Well, the experience was actually better than I had even anticipated. We did my procedure at CHOMP as an outpatient.
So that's, for those of the people out of this area, CHOMP is Community Hospital of Monterey Peninsula. It's a
Yes.
fine hospital.
Oh, they were excellent.
I'm happy to hear you say
very,
that.
very efficient beyond belief. Very efficient.
I'm happy to hear that. So the outpatient surgery center is not in the hospital. It's a surgery center that's attached to the hospital with a hallway. So that's the place you selected. The surgery center here that I use downstairs in my office, they're in the hospital. They're both licensed and accredited, and licensed, accredited, and certified. And so sometimes it depends on what's available and convenient, and sometimes there's an economic difference. But you and my wonderful staff selected a day to meet me at the outpatient surgery center, and you had an anesthetic, correct?
That is correct.
Okay.
Yes.
So they started an IV.
Started an IV, practically painless, and I'm just not saying that, practically painless, right here in the top of my hand. She started the IV for the anesthesiologist.
Okay.
And it was just very, very easy. I mean, it was just no drama, which is great. I mean, especially when you go into that kind of procedure, I think the last thing somebody wants to experience are a couple pokes with a pin or whatever. I mean, it was just so amazing. It was just very easy.
Okay, so you had an intravenous IV started by,
Yes.
by an expert pre-op nurse,
Yes.
and you had a anesthesiologist who completed a residency in anesthesia, and I believe is board certified. So then you went into the operating room from the pre-op area. Oh,
Yes.
let's back up a moment. But before you were sedated or anything, I met with you.
Yes, and
Right.
when we discussed again, went over, you told me what to expect. You made a little bit of markings. You know, you were very meticulous about, you know, looking, making sure that everything was okay. You made your markings, and then I was taken into the OR room.
Okay.
So from the time that I got to the surgery center to the time that everything was exactly on time. You told me when the surgery was going to be. That's exactly when the surgery started. So everything went off like clockwork.
Okay, let me back up one moment. The markings are actually quite extensive. They weren't just little markings.
I didn't see them. I just felt you put them on me.
Okay, I almost, in my mind and with my mind's eye and my hands, when I do the marking, I'm doing the operation, actually. It's almost like a dress rehearsal, and I visualize the changes, and I poke and prod and mark and look and poke and etc. There's a lot to it, but that's sweet. That
Well,
you
see, that's how good you are, because it didn't feel like anything. It didn't feel like it was that big of a deal, but...
Well, you're very sweet and very gracious. Thank you. So then we wheeled you into the operating room. Now, something that goes on that you may or may not remember, but it's something that I do in my practice. Some people believe in some subconscious pain, whether you do or not, I don't know, but I do. And so after you took a nap, I numbed you up anyway. So even though you were under an anesthetic, I really make people comfortable and numb. And the effect of that is it allows the anesthesiologist to lighten you up, so you don't need a deep general. You can just almost be twilight because you're numb. And it helps me dissect in the planes, and we know that you're comfortable. And you know, there are the stories that go around when people say, oh, you know, I was worried that I was going to wake up. But you're numb anyway. And the anesthesiologist is monitoring you, your heart and your lungs, and I have a nurse, an RN right there circulating, and I have a scrub tech and sterile instruments and betadine and everything we need. So what about the procedure? You had some incisions made, right? Do you
Yes.
want to talk about the recovery period, comfort level, and bandages, and when I saw you, and activity level, etc.?
Sure. After the surgery, I did go home that day, and I virtually had no pain. And now I know it's because you did additional numbing. But I didn't have any pain. You did prescribe medication for me. I went ahead and filled that before the surgery, but didn't have to take any of it. So the incisions that I had were here under the chin, and then I had some incisions around the ear and then in back of the ear. And I had a couple of tubes with bulbs in the neck area. The bandages were around the bottom of my chin, which were very comfortable. That night I did sleep on my back like you told me I needed to. I was very compliant. I slept on my back like that, making sure I wasn't going to roll over either way. I was seen in your office the very next day, and I was just like I am right now. There was no grogginess. There was virtually no pain. I had swelling, you know, because of the incisions, but certainly did not look like what I had just gone through. You took out one of the little bulbs and left the other one in that I had in for another day. I came back like I think the next day or the next day after that to have that removed. And the healing was very quick. I had swelling for a few days in the neck area. It looked great almost immediately. All this was gone. All this was gone. You did such a great job that it even smoothed out this part of my décolleté. I mean, I was getting the wrinkles like this. They're practically gone because of that lift. So this whole area right here has been totally rejuvenated and looks fabulous.
Well, Gio, first of all, you started out looking great. You've
thanks.
taken great care of yourself, and you have a great facial structure. And I'm delighted. I'm happy because you're happy, because I think we got a lot of nice change. You really did you made a good decision for yourself and did a really good thing for yourself. Now, if you don't mind, now Michael Martins is our terrific producer and control booth man, do you mind putting your hair behind your ears?
No,
just
not
for,
at all.
Just for a moment, so people can see now. How long ago did we do this, Gio?
It was on June 27th, so not quite 3 months ago.
Okay, not quite 3 months ago. And okay, so let's go over the activity again. So you took it easy.
For 11 days, you told me I could not go to the gym for 11 days. Again, I was very compliant because I was serious about recovery.
Okay.
And I was serious about, you did such a fabulous job that I wanted to make sure that I was going to have continued healing.
Okay, so Gia, you're very gracious. Now, but I want to get a little more detailed. What we tell our patients is for 3 days and 3 nights, you rest and take it easy. Now, it doesn't mean lay in bed, but rest and take it easy. You mentioned the tubes, the bulbs, those are drains. That's because I did a lot of work to sculpt and mold and shape and tailor your neck and chin and jaw area. And it helps with the swelling and recovery for 1 or 2 nights to have drains, and people manage those. Was it a big deal for you?
No, you had, or the nurse had pinned them actually to the shirt that I was wearing, so there was no movement. They were stationary.
Okay, great. So for 3 days and 3 nights, we rest and take it easy at home, or the hotel, or the recovery center. And then on day 4, more activity, but don't get your blood pressure up high. And then I tell people on day 11, you slowly edge back to your life. And you came in how often for suture care, checks, things like that?
I came in the very next day, and then I came in either the next day after that or the next day after that. I can't remember if it was 1 day or 2 days after that. And then the next week. And then I think I came in because I had some more questions on a different process. And then we looked, but I think probably about 3-4 times.
Okay.
So you could monitor my healing.
Right, and that was all included?
That was all included,
Right.
yes.
Okay, so Gio, in summary, you're pleased?
I'm very pleased, yeah. I am very pleased, and I've got some very envious 60-year-old friends.
Well, Gio, I'm happy that you're happy. That's really, I mean, it's important to me. That's one of our, I love to have at least 99% delighted patients. Now, how about as a skincare professional and a patient who's undergone this, what advice or some thoughts would you offer to someone who says to themselves, I wonder if I need a facelift, I wonder if I should have a neck and jowl lift, what's the difference between a neck lift and a facelift? Like, do you want to offer some thoughts?
Well, the great thing about the internet now is you can do a lot of research online. So I think the consumers are much more educated than they used to be a number of years ago. But you put together that fabulous series, and I really do think that it is beneficial for people to go and see you in person, whether they talk to you or not, but just see how you are, see your before and after pictures, meet your staff, see your office, because that really does raise somebody's comfort level. And those are things that really should be taken into consideration for any consumer that's about ready to make an important decision like that. I've got a friend she went south of the border to have hers done, and now I'm talking to her about coming to you for correction. So you really do need to do research, and it can't be about money. It really has got to be about quality. It's got to be about a quality surgeon. It's got to be about a quality facility.
Well, Gio, I'm very grateful that you have this willingness to come on and teach people. It's so great.
My pleasure.
I would like you to stay,
Okay.
and we're going to talk about more of your professional life, okay? But
Okay.
in the meantime, I have a little something for you.
Oh.
Can we just say thank you?
Thank you.
For taking 19 minutes
Thank you.
of your life and coming on the program and teaching.
Beautiful.
Thank you very much.
Thank you so much.
Gio Stefagio, you are a licensed esthetician, and you're licensed in multiple states.
Yes.
And you're going to stay, and we're going to do a segment on you as a medical provider. Okay?
Perfect.
Wonderful.
Thank you.
Thank you for being here.
Thank you so much.
Once again, this is the Doctor is in Television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. If you have any questions about the natural neck lift or anything related to your appearance, I hope you'll check out my website, drmorwood.com, DRMORWOOD, or call the office here in beautiful Monterey, California, 831-646-8661. We're going to take a very brief pause for a very good cause. Please stay with us. More of Gio Stefagio. Thanks for being here.
Thank you so much.
Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. One of the common goals I share with my patients is that they look natural after their facial rejuvenation.
Dr. Morwood made me feel really comfortable. His staff is phenomenal. Going into his office is always a great experience.
Call or click today to learn how our combined approach of art and science can enhance your natural beauty. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. A smooth, firm neckline is a universal sign of beauty in both women and men.
Dr. Morwood not only helped me regain my confidence, he helped me achieve the best version of me.
Call or click today to learn how the natural neck lift can rejuvenate your beautiful neck and jawline. Welcome back to the Doctor Is In television program. I am Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for being here. I'm delighted to have a very special guest, Gio Stefagio. Gio, you are a licensed esthetician. I know you're licensed in many states.
Yes.
So thank you very much for coming on the program.
Thank you for having me.
The last segment, you talked to us and you taught the public as a patient because you had a natural neck lift. This segment, it's really about you and the aesthetics care and medical care that you provide. So, Gio, thanks for coming on the program.
Thank you.
Let's start by talking about what an esthetician is and what an esthetician does. And I want to talk about facials, and I want to talk about high-quality skincare and why we should avoid the sun, and why is it important to learn to properly cleanse and moisturize, etc. So, how long have you been an esthetician?
I've been an esthetician in the state of California since 2012. Before that, I owned a day spa. And before I owned the day spa, which specialized in anti-aging and skin correction, I owned a small beauty supply store. So I've had a passion for beauty actually ever since I was a kid growing up. We had slumber parties and I would cut their hair and color their hair and, you know, do skin scrubs, and I've been doing that ever since I was a teenager. So it's been a passion of mine for my entire life.
Gio, I want to compliment you. You have great skin.
And thank you.
And I think you look far younger than your stated age, which it's a tribute to you. You've taken care of your skin. I
love skincare. It's just every single day I do something about it, I read something about it, and the technology is so much better than it used to be.
Okay, so let's start to talk about some specifics, because nobody knows really what skincare is unless they're tied in with a plastic surgeon or esthetician, dermatologist, etc. So let's talk about the key essential elements to skincare. And I know we could talk for hours. We have about 15 minutes left or less. So what are the essential elements to skincare? How do you teach your clients and your patients?
Well, I was always amazed about how many clients would actually come in, like maybe they'd get a gift certificate for a facial, having never had a facial before in their entire life, or a reason to go to a dermatologist. They would come in, I'd read their intake sheet, and I was stunned. They'd be using something like Irish Spring on their face. And so I would walk them through their concerns on their skin. And it was just amazed that even though people that did buy over-the-counter products like oil of Olay or whatever, they weren't properly diagnosing their skin. So as a skincare professional, we look at two things. We look at skin type and skin condition. Those are the two things that we look at immediately. A skincare regimen will include proper cleansing, and everything that I cleanse with has some type of an acid in it. alpha hydroxy, a beta hydroxy, a salicylic acid, for instance. So that's like a progressive, tiny little peel every single day. It keeps the skin exfoliated. Then you want to treat the skin. And that could be maybe your skin is dry, or maybe you've got rosacea. And then, of course, you want to moisturize, and then you want to protect. So those are the basic things that you want to do on a daily basis with your skin. Properly cleanse, properly exfoliate, treat, and then protect.
Great. Gio, so one of the messages that I try to convey to my patients, if there are two elements that I can teach patients who are interested in pretty skin, good-looking skin, men and women, avoid smoking.
Definitely.
And don't bake in the sun. And in fact, try to avoid direct sun. Isn't that correct?
That is correct. And I think right now the public is getting mixed messages, because you hear on one hand that people are being diagnosed with vitamin D deficiency, and then they're attributing that to wearing sunblock from head to toe. But there are healthy ways of doing it. I grew up in an era where we put iodine in baby oil and used to bake out in the sun for hours. So now that I'm at a certain age, I have that skin damage that I'm correcting for years. For like the last 20 years, I've been correcting the skin damage from what I did when I was a teenager. I did have some clients that were heavy smokers. Asphyxiated skin is very difficult to correct. Sometimes you do damage to your skin that you can't undo. The best you can do is treat the damage and then move forward, with proper exfoliation. Might even need to have a peel or laser treatment, especially, around the smoker's lines, around the mouth. But it even discolors somebody's skin.
Okay. So we mentioned avoiding smoking, and we mentioned avoiding direct sun. Right?
Yes.
So you talked about protection. Now there are a few other key elements. You've talked about properly cleansing.
Yes.
And there are different types of skin. Some people have oily skin, some people have dry skin, and then there are people with patches, right?
Yes, there are.
Okay, so properly cleansing and properly moisturizing and protecting. And you also mentioned exfoliation, and I want to teach our viewing public what exfoliation is. And there's another key element, and that's stimulating and regenerating, because we know that baby cells are manufactured and made in the basal membrane, or the layer in the dermis where new baby cells are made, the germinal matrix, regenerative layer, etc., basal membrane. And there are ways that we can stimulate more collagen, right?
Yes.
So let's talk, if we can, let's go step by step. We already mentioned no smoking, we already mentioned no baking in the sun, no direct sun. So let's talk about exfoliation, moisturizing, stimulating, protecting, etc. So can we talk? Let's teach the public what we mean by exfoliating.
We've got a couple different, actually 3 different kinds of exfoliation. We've got a mechanical exfoliation, like microdermabrasion, a chemical exfoliation, like a progressive salicylic acid every single day, or a peel, like a TCA peel, like you do in your office. That's a really good exfoliation. And that also creates the environment in your skin that forces your body to produce more collagen, to build, so you have a much better, younger, youthful look.
Okay, so can I add something?
Sure.
I know you're their skin professional, but I want to add something. The very top layer of skin in everyone, that's the keratin layer. It's
Yes.
not living.
No.
It's like hair and,
Right.
and nails.
Needs to be sloughed off.
It's made by living parts, and we don't want it to be totally absent because it serves as a protective, kind of a protective barrier. If we didn't have a keratin layer, I think we would just get too dried out. But we don't want that to get too thick, right? If someone,
Right.
let's say they're a fisherwoman, or someone bakes a lot and they don't take care of their skin and they get wind and sun, that keratin layer can get thick and people lose the sheen, right? They get kind of a dull skin,
look,
right?
exactly, yes.
So what you're talking about is getting the keratin layer to be a reasonable thickness and also to stimulate, right?
Yes.
And I think that's our next, how is it that we can stimulate new baby cells to be made, and new collagen? How do we do that?
Well, through exfoliation, I think one of the best things, the best ways as you get older would be through a peel. Different people at different age require different things. My skin being 60 years old, if I wasn't constantly doing something to it, I would have that keratin, that thick layer on my skin. But because I address it often, you know, I don't have that, but some people don't. So exfoliation, taking off that dead skin, and also as we get older, the cell turnover is not 28 days anymore like it was when we were young, where the new skin cells float to the top, and you know, now it might take twice as long. So by doing these other procedures, we stimulate that and force that process of skin renewal.
Great. Okay, I think that's very clear, Gio. Thank you so much. Now, a couple of things we want to talk about. You talked about cleansing, properly cleansing.
Yes.
Now, how is it that you will teach a person with ultra dry skin perhaps a little differently than someone who has oily skin, right? Now, don't you sit with them and analyze their skin and teach them differently about properly cleansing? And then,
Yes.
And then we're going to talk about properly moisturizing and applying a sunblock.
Yes. Let's say I've got two clients. One happens to be like maybe in their 20s and they're still experiencing breakouts. And then I've got another client who's mature with the drier skin. The younger client, I would suggest perhaps a cleanser that had a glycolic or a salicylic acid in it, whereas maybe a lactic acid for the more mature skin. They're still going to get that cell turnover, but it's not going to be as caustic, if you will, for the older skin. So, and a lot of consumers don't know this. They just go in, oh, this is on sale, I'll get this, or this happens to be the store brand. So they use the wrong kind of product for their skin. So not only are they creating more inflammation, you know, they're making the problem sometimes worse by not having their skin type and skin condition properly addressed. And a skin professional could tell you that. Sometimes somebody doesn't know that they're a Fitzpatrick 3, for instance, or a Fitzpatrick 4. So they use products that are maybe for a Fitzpatrick 1 that doesn't do them any good. And the same thing with the skin condition.
Okay, great. So let's take this as a teaching point. You talked about the Fitzpatrick scale.
Yes.
So there's 1 through 6. And essentially, it's how much pigment is in your skin and how easily you tan or burn. So Fitzpatrick 1 are those people from very northern Scandinavia, blonde, blue-eyed. They never tan, but they burn. All the way to Fitzpatrick 6, there are parts of Africa where people have so much pigment in their skin, they're really almost black, brown. So that's Fitzpatrick 6. Most people are kind of in the range of 2 through 5, right? There's some dark skin Hispanics, there's some lighter skin Hispanics and Asians, etc. There's some Europeans with more pigment in the skin. But according to that scale, where you're categorized can dramatically influence the type of therapy that you recommend. Isn't that true?
Exactly. Even going up to laser therapy. Skin peels. You've got to be very careful when you start getting past somebody that is a Fitzpatrick 3, for instance, because a laser or a deep skin peel could cause hypopigmentation to where they actually have white spots, lighter spots on their skin, which is a type of a scarring, as opposed to somebody like me who's a Fitzpatrick 3. It's very safe for me to do IPLs, lasers, TCAs. I'm not going, unless it's gone horribly wrong, I'm not going to get scarring. Somebody on a Fitzpatrick 1 being so fair complected, like Nicole Kidman is a Fitzpatrick 1, like almost pink skin, you know, very light eyes, light hair. She would not do well with the kind of therapy that I would do, but she would do very, very well with certain kind of peels.
Okay, great, Gio. That's very helpful. Now, let's talk a little bit more about the facial, right? And there's this word that people use. Well, I got a gift certificate for a facial, and I don't really know what a facial is, but I'm going to schedule. So, to you, what's a facial, and why are they important, and why is it that they're valuable? What is a facial?
A facial...
excuse me, with a licensed esthetician. Now, sometimes people can have their sister at home say, oh, well, yeah, sure, I know how to do a facial. But you're a licensed esthetician, and in some states you can do laser and you can do some minimally invasive procedures. So to you, what do we mean by a facial with a licensed esthetician?
I think that there are two different kinds of types of facial. There is like the feel-good, massage your neck and hand, and I'm going to put something on your face that smells good. It might be a raspberry enzyme, something that is going to not be really effective. Those are the kind of facials where the lights are dim or whatever. The kind of facials that I do, the lights are on, I'm looking at your skin because I've got an acid on your skin, and I am looking to make sure that it's exactly what it's supposed to be doing, that something is not going sideways. That's the kind of facial where you're going to get the correction. And that's the kind of facial that especially you need the post-care. The other kind of facial, post-care is not that big of a deal. It's nice, but the clinical facial, post-care is critical. Because if you come in and I do a type of a peel on you and you go out and sit in the sun the next day, and then 3 months from now you got post-injury hyperpigmentation on your face because of what we did in the facial room because you didn't take proper care, you're never going to get that happen on the, I call it the foo-foo facial, you know, where you go in and get your neck massaged and your hands massaged.
Okay, great. Well, Gio, we only have about a minute left. Of course, I could talk to you for hours, and I appreciate your willingness to teach. Now, one of the procedures that I will sometimes do for my patients is a TCA peel. And TCA peels can come in all types of concentrations and depths, etc. What I do typically requires numbing or regional blocks or even an anesthetic. It's a surgical peel. So how can the esthetician help with preparation and post-op care for something like a TCA peel or even laser resurfacing? How does the esthetician get involved?
After the peel is done, actually even before the peel is done, because some people need to have, most people need to have, they need to prepare for the peel. It's very seldom that you can actually go in one day and have a peel out of the blue. You really do need to prepare, whether it's using some type of a hydroquinone if the doctor prescribes it, or something that is going to suppress the melanocytes. So you're not going to get that post-injury hyperpigmentation. And again, it just depends on your Fitzpatrick. After you have the peel, then it's imperative to make sure that you use the right kind of product. You don't want to have a peel because you're investing your time, your healing, and your money, and then go home and use a bar of soap on your face. You want to make sure that you use the right kind of products to prolong and to enhance your procedure that you've just done. And the healing is probably not real safe to use, you know, those other types of soaps on skin that you've just had that kind of procedure with anyway. So you really do need to be careful about medical grade skincare. Don't get a peel and go out and put bar soap on your face. That's the biggest thing.
Got it. Gio Stefagio, you are a
Yes.
licensed esthetician, and I'm just so delighted that you have a willingness to come on and the program and teach people. Thank you very much.
Well, thank you so much,
I
Dr.
appreciate
Morwood.
it.
I appreciate you too.
Well, thank you so much. This is, once again, the Doctor is in Television program. I am Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for joining us. Thank you, Michael Martins, in the control booth. If you have any questions about beauty, appearance, any type of procedure to improve the way you look, drmorwood.com or 831-646-8661. Thank you very much for joining us.